Okay, so again, thank you everyone for
Sorry to cut
coming.
you off.
No worries, coming and introducing themselves today. So just wanted to kind of go over the agenda for the call. We will be touching base on the patient safety and healthcare quality industry overview, go over program details, curriculum, the interdisciplinary collaboration and online learning format for the program, highlight some of our faculty, touch base on the admissions requirements, financial aid, and then if you guys have any questions, of course, feel free to stop anytime, but we'll have a dedicated Q&A time frame for that.
So we are going to go through these slides pretty quickly, and you can have access to them after, but so that we can get to questions. But so anyway, patient safety is no longer a little hobby or cottage industry that it was when we started. It is now, sort of an integral part of operations for health systems and clinics and healthcare everywhere. In fact, all over the world. Uh, all over the world, study after study suggests that 1 in 10 patients on average who are hospitalized for something wind up getting harmed in some way by healthcare, which is kind of crazy. There are looking at drug events. There are at least 1.5 million preventable harms caused by medications in the US every year. The cost of unnecessary tests, harm from misdiagnoses, legal payouts exceeds $100 billion a year in the US. There are proportional costs in other countries. And there's been a little bit of a race between medication errors and inaccurate diagnoses, as which is the worst, most common cause of significant medical errors. Diagnostic errors actually wind up being quite costly sometimes. Next, please. Oh, I should read. Never mind. That's fine. So there are now lots of positions in patient safety and quality, I should say. Um, there are lots of folks who either started out interested in quality and safety or started out managing or taking care of patients and realized how important it was. And the big challenge still is there is a lack of expertise and training and science still in all sorts of areas that are necessary to do the work, designing projects, analyzing, collecting data about safety issues and analyzing the data, measuring problems and measuring progress. And so the concepts and skills that we teach in this program are things that people use. They're intended for practitioners, really, to be able to apply them, understand what they're doing, but really apply those tools. And there are many possible job titles these days, which range sort of up and down, sort of the whole system, including director of quality management and patient safety officer, nurse director of clinical quality improvement, risk and quality improvement director, vice president of quality management, vice and patient safety officer, patient safety consultant. And our grads, some of our grads are in all of these positions. I had the opportunity to visit another university medical center who has a patient safety training program of their own. The interesting thing is that virtually all of their lectures are given by people who are from other institutions. And
Wow.
the problem that they profess is that currently in their own institution, there are not enough people who are really expert enough in patient safety to teach those lectures. So they're trying to train people up, and who knows, they could train some of you potentially. Though we do hope that those of you, at least in Baltimore, stay here. Next, please. So this is a full master's degree program at Johns Hopkins. It is really skills-based and tools-based. It's part-time for most people. It's 100% online, which makes it easier if you're not in Baltimore for sure. It's about 48 credits, and it's designed so that in general, people take up to two courses in each of the 4 quarters of the year for 2 years. And you could do it in 3 years. You could do it in 4 years. If you do it in 4 years, you might take only one course per quarter. Sometimes people will take a quarter off. Some people are on a 5-year plan, and that's all fine. It's very skills-oriented. There are projects, lots of examples, lots of hands-on learning. It is a public health master's degree. It's not a management degree. And we feel like this is a little bit closer in many ways to healthcare than when we're really trying to manage patient safety than trying to manage people. Next, please. So this is what the curriculum looks like if you do it in the 2 years. Everyone needs to take a little sort of half-credit course on the essentials of health. But in general, there's usually one, or sometimes two, but usually one patient safety course that you would take. In that first term, there's an intro. Actually, we've just swapped it. It's intro to patient safety. And there's a public health seminars course that's focused on safety. In the second term, there's the intro to quality of care and a case studies course on patient safety. In the third, there's the intro to epidemiology, because everyone does a couple of quarters of epidemiology and biostatistics. Some people find this a little scary, but you're going to be dealing with numbers. You're going to be dealing with designing ways to evaluate things. So this is really, I think, an important part of our curriculum. There is a writing course, because you're always writing memos, writing proposals, writing reports. So there is a professional writing course. In the fourth term, there's statistics and leadership in safety and quality. Year 2, a little more stats, a very useful course on quality improvement tools, things that you might use, are calculated to use teamwork training, Six Sigma, the comprehensive unit-based safety program, communication tools. In the third term, there is a great course on measurement and evaluation of quality and safety. You're always going to try to be figuring out how you're doing. There's a terrific course on infection prevention. And finally, in the fourth term, you will do an integrative activity, which will start earlier in the year, that gets you to work on a project, ideally something you're really interested in. And alongside that, there is a terrific course on measurement. It's a measurement lab, actually doing quality safety measurement, and it's run by our own Matt Austin. Next, please. So I think our program is a little unique. It is a real curriculum between the 3 major schools here in East Baltimore: the School of Public Health, the School of Medicine, and the School of Nursing. Our faculty draw from leaders in all of those places. It's coordinated by the Armstrong Institute, which is arguably one of the top patient safety institutes in the world. There are things on the slide that I'm not seeing because it disappeared, but I'm going to improvise for a minute. But our faculty are generally people who are working in quality and safety. They are among the top experts in both research and practice in patient safety. And they are there leading your lectures, which we'll see in a second. Anyway, we've been doing online learning. I realized that I've been teaching online safety since about 2005. Hopkins is a real leader in online courses. When the pandemic hit, we converted every one of the courses in the School of Public Health, which is several hundred, to online so that they could be done at least hybrid. All the lectures are recorded, and so you can see them whenever you can review them whenever you like. You can binge watch them. You can watch them over and over. In any event, I think that they're really very high quality. Next, please. Just some of our faculty. I won't go through this whole list, but I'll besides Professor Austin, who is really in charge of the measurement and analysis of all the Leapfrog group data nationally. Jumping down a little bit, Lisa Maragakis is the head of infection control and hospital epidemiology for the Johns Hopkins Health System. Jill Marsteller is a leader in evaluation and management for patient safety. John McGreedy is someone who makes biostatistics fun. That sounds odd, but people love his course. Laura Morlock is one of the founders of risk management. Lori Payne is a nurse who was the director of patient safety for the hospital. Peter Pronovost is, of course, one of the world's leaders in patient safety. Mike Rosen designed some of the leading teamwork training. Kathy Sutcliffe invented high reliability organization management. So these are people who are world's experts, and they teach the courses. Next, please. So I'm going to pass off to Morgan. How does this all work? You're on mute, Morgan.
Can you guys hear me now?
Yes.
Okay,
Yeah.
sorry about all the wonky tech issues today, guys. Um, so applications are currently being reviewed for the program. We kind of go on a rolling basis. Once you submit all of your application materials to us, we try to get a decision back to you within about 2 weeks. The deadline to apply for the program is June 1st, so right around the corner to get started this fall. Could you get the next slide for me? So let's chat a little bit about the admissions requirements for the program. So everyone submitting their application, a lot of you guys have started it, needs to submit their applications through SOFAS. You have to upload your transcripts proving that you have a bachelor's degree from an accredited college or university. We need your official transcripts, so that's something I always say to start with sooner rather than later. For this program, you need a minimum of 3 years health-related work experience, so post-baccalaureate experience. For the application, you have to upload a resume or a CV, kind of detailing that experience as well. This program requires you to submit a minimum of 3 letters of recommendation, but you can submit a maximum of 5 letters of recommendation for the program as well. We always suggest at least one of those letters of recommendation should come from a supervisor, professor, someone who's kind of been above you. The other letters of recommendation can come from other peers or colleagues who've seen you in a professional or academic setting. Now, what I say is the most important part of the application is the statement of purpose and objectives. This statement is your opportunity to really introduce yourself to the admissions committee as an applicant. In the statement, it's important that you have a couple of things. So it's important that you explain that you kind of know what the program is about. We want to make sure people are applying to the right program. In the statement as well, we need to kind of know a little bit about your experience, what's motivating you to pursue this program, and I guess what you want to do, once you graduate. This program again is really taking the applied science to heart. So we want you to be able to kind of, learn everything in the program and apply it to your career the next day, ideally. So we want to know that you kind of have a goal in mind when pursuing the program. So for international students, there are a couple of extra things we need from you guys to submit your application. One is an English proficiency test. There are some ways to kind of waive the English proficiency requirement. That would be like if you have completed a degree in English. Some countries are exempt from taking English proficiency requirements, but we can talk about that more on a one-on-one basis. Second thing is your transcripts. So all non-domestic transcripts need to have a course by course credential evaluation completed. That is again something that tends to take a little bit more time than you would think. The evaluation service that we recommend is WES. But yes, we have to get that in. And once you submit your course by course evaluation application to WES, they'll send it right over to us. So no need to worry about kind of getting it over to Sophus after that. Can you hit the next slide for me? Okay, so tuition. So let's chat about tuition. For this program, it is 1,458 per credit. This program also offers students a MAS scholarship. The MAS scholarship is $560 per credit. So that brings your per credit amount to 898 per credit. Now, some students decide to complete the program in 4 years versus 2 years, strictly for financial reasons, because you are charged each term per credit. So if you're taking the program in about 4 years, it makes it sometimes a little bit more manageable to fund your education. So with the scholarship, don't worry about having to do any extra applications for that. The scholarship is automatically applied to all of our admitted MAS students. There are also some external scholarships that many students have used before. So if you're interested, I can always send that email out with the link to those external scholarships. Beyond scholarships, we have a great financial aid office that is willing to answer any questions you have about financial aid, especially federal financial aid and private loans. Okay. So now is our Q&A session. I did see there were a couple of questions in the chat. The email here is to the MAS office, so you have any questions, definitely feel free to reach out there.
Thank you very much, and thanks for listening, you guys. The This is, I would say, this is not cheap. On the other hand, it is it might be as much as 50% cheaper than our MPH program. So it is a little bit of a bargain. And if you could, I guess if you could think of it that way. But happy to take any questions that any of you have. And Professor Austin, and I will try to answer all of them.
Thank you. Hi, this is Trivia. I do have a question. I know that the Johns Hopkins has the guild. So does this can this apply, the financial aid apply to the amount that they give you yearly for student tuition reimbursement?
Yes, you can use your student tuition reimbursement towards the program.
Oh,
So we do have students, in the Hopkins system. So total, the program is about $43,000. Some different institutes in Hopkins, give different amounts of funding. Some give about 10,000. So people who are getting like $10,000 a year, those are definitely people who are spreading the program also out over 4 years. So it can be essentially fully funded by their Hopkins Institute.
Great question, though, and that could make it a lot easier if you're working, but not getting paid enough that you could manage, sort of $40,000 in one lump sum. That tuition remission benefit, you'd have to check with your department, but it can be very helpful.
Okay, so we have a couple of questions in the chat. Could you explain how you've integrated AI into the safety and quality curriculum?
Matt, do you want to take a swing at that?
Yeah, so I'll do my best and would welcome your contributions as well, Albert. I can specifically speak for my course. We're I think starting to explore ways that artificial intelligence can help us measure the quality and safety of care. And so for this year, we've chosen to sort of introduce that as part of our student engagement around discussion topics. So one of the requirements for the course is we have a discussion forum. And so one of the discussion topics is around the use of artificial intelligence in measuring quality and safety, right? And what are the potential promises of that? What are the potential pitfalls? I think the technology itself has some real opportunities, but I also think we need to be a little careful with how it gets used. And I think generally within the Armstrong Institute, we're doing a lot of thinking and a lot of work about what is the right role for artificial intelligence within patient safety and healthcare quality. Albert, do you have any sort of additional insights of other courses and how that topic has been woven in?
Yeah, I think it's been woven in. There's no course on AI. But I think that where I've heard it's being used the most is so all of the courses, all of the lectures are online and asynchronous, but every course has 2 or 3 sort of synchronous, that is face-to-face or face-to-screen or screen-to-screen interaction. And that is where discussions about how AI fits in has been introduced. I think that we are in the projects that people do. There are all of the courses are a little bit project based, so virtually all of them have you do something, some exercise. And exactly how AI is integrated into those varies from course to course.
Okay. Another question we have in the chat: can the integrative activity be used as a Six Sigma black belt project?
It could certainly be. I mean, it depends on the course that you're taking, but there's no reason why things can't double dip. We've had people who've had that integrative experience serve as a report that they needed to complete at work, something that they were assigned to do. We've had people publish a couple of their integrative experiences. Someone turned one of them into a course that they taught or the basis for a course that they taught once. So, your integrative experience is your product. So you can use it any way that it would be allowed to be used. There's a question actually from Katie about work experience post BS. I think that the post experience can be, we realize that not everyone gets a BS before they start doing their work in healthcare. So I think 30 years or 20 years definitely counts as more than 3 years of health experience.
Someone would like a little bit more information on the scholarship and if there's any chance of 100% fee waiver for the course, any stipend for attending on site. So I will say there's no stipend for attending on site, more or less because this is a program that can be completed online. The program is completely online. We have students from all over the world pursuing the program. So for that reason, we don't necessarily do on-site stipends, visas, things like that for that program because again, this is an online program. And then there is a question about the English proficiency exam. Um, there are certain exams that we accept, and I am going to put that in the chat. So we do the Duolingo English proficiency exam, the Pearson test, IELTS academic, and then the TOEFL, TOEFL. Those are the accepted English proficiency exams. Um, and then the scholarship that we offer only covers about 38% of the tuition for the program, but there are external scholarships that people pursue that kind of they use to make up the difference. So in the chat, I'll also send a link for those external scholarships as well.
And what about
Hey,
course evaluation? Some courses that you might have taken in a master's program before. Can you submit for evaluation of the courses that's here?
Yeah, great question. So Johns Hopkins School of Public Health unfortunately does not accept transfer of credit. However, we do not want you to take courses that you've already taken previously. So how we kind of skirt around that is, let's say you've already taken Epi 1 within like the last 5 years. You'll have the opportunity to, for lack of a better term, kind of test out. So we would evaluate your course, your grades, and then you can take an exam. And instead of taking Epi 1, you would just sub in a different course that would kind of align with the curriculum of the program.
one thing that I will add to what you said earlier, Morgan, which I think is one of the great just advantages and opportunities of this program is throughout the nearly 10 years we've been running this program, we've had students from every continent in the world, probably from 40 to 50 different countries. And so I think one of the great opportunities is is sort of the worldwide student participation in the program, the ability to learn from others throughout the world, and yet have sort of a common goal of improving quality and safety of healthcare in sort of the local context.
Yes, hello, can I ask a question?
Sure.
Absolutely.
Okay, you talk about uploading our transcript. And you also mentioned about our official transcript to be sent to the college. Could you explain that?
Yeah, so let's talk about transcripts. So for domestic transcripts and English speaking Canadian transcripts, what you can do is you would be able to go to your previous college or institution and request that they send those transcripts directly to SOFAS. As you're matriculating through your application, it will be a point in your application that will direct you to do that. Once you just include where you've graduated from, they'll direct you to like National Clearinghouse or directly to your college to send those transcripts. For people who have completed courses outside of the US, you would have to have your transcripts have a course by course evaluation. Our evaluation service of that we like the most is West. West. So essentially, you would start an evaluation through West. Start an application there, upload your transcripts, and follow those directions that Wes has outlined. And then Wes will then send the transcripts after they have done the course by course evaluation to us, just validating your education.
So in the application profile, there is a place there's a link for your official transcript. Am I right?
So in the application profile, you will say, for example, let's say you graduated from University of Maryland, you would write that in the application. And then the next step, it would say, hey, do you want to order your transcripts from
Okay.
National Clearinghouse? And then it will give you a link to do that. And then once you do that, that will be sent to SOFAS.
Okay. The only method of applying is through SOFAS. Am I right?
Correct.
Okay. Another question is what is the relationship of Armstrong Institute with Johns Hopkins University? I say that being an employee, I'll be trying to figure that out.
So just about all of the faculty are members, core members, or affiliated members with Armstrong Institute. So several of us run programs at Armstrong. And and we discuss the whole program on a pretty regular basis with, at sort of various Armstrong administrative meetings. The course is run through the School of Public Health, because that's who grants most of the degrees, that's sort of the postgraduate degrees at Johns Hopkins, medicine and university.
So Armstrong is autonomous, right? It's separate.
Armstrong is the quality and safety arm of the whole Johns Hopkins medicine.
Okay.
But it's also a research institute.
Okay.
But it's not
Armstrong is part of Hopkins.
Yeah.
It's what?
It's Johns Hopkins Medicine Armstrong Institute. It's part of the whole university calls themselves Johns Hopkins University and Medicine.
Okay.
And medicine is nursing and public health and the medical school and so forth.
Okay.
These are all great questions. We would appreciate, this is your chance. We're happy to try to answer any question.
I have a question.
Yes.
So, what is your acceptance rate? And do you guys only accept so many seats? Like, how competitive is it to get into this program?
So, I can say that Morgan had mentioned the importance of the essay.
Yes.
If you have successfully completed some previous training, if there's evidence that you would be able to complete the especially quantitative parts of the program, because some people honestly say, I don't do statistics, and they're not going to do well in the program.
Right.
But most importantly, if you can make a good case for why you would benefit or why your career would benefit from having these additional skills, there's a very high likelihood that you will be accepted into the program. So I would say that, without seeing, sort of not seeing any credentials or anything else from any of you, I suspect that virtually all of you, or most of all of you, would be acceptable, assuming that you have some basic credentials to wave around.
Okay.
Another important question. Oh, sorry.
Oh, I'm sorry. And so if I get through the application process, do you guys also do an interview after that? Or once you're accepted in, you're accepted in? And then you're just, okay.
This is your interview.
No
And
pressure.
And
No
your
pressure,
statement.
Okay,
Thank you.
if someone has taken statistics in undergraduate for a long time, will you suggest that someone can go back and take retake statistics to be more familiar with your
Yeah. I would suggest that if you took statistics once upon a time, then it would be a great benefit to take the Johns Hopkins biostatistics course. It's very relevant to the work that you might do in the future.
But the real statistics is needed. Am I right?
You must pass biostatistics and basic epidemiology in order to graduate from the program.
Okay, we see.
Mukesh.
Yes, Dr. Wu. Thank you. So my main question is about funding, because some of the international applicants and people from developing countries, for example, as a doctor who is working for more than 15 years in a government setup, I make only around $14,000 per year. My total
Yeah.
annual income is. So that means to afford this course, I have to spend my entire 4 year income. That means after my expenses and all, I will be spending my 10 years of income to afford
Yeah.
this course. So, is there any possibility that, example, can I compensate that fee instead of the fee? Is there any possibility that I can work for certain aspects for the program? Um, uh, any other works that is possible? I know that you cannot pay students, but instead of the fee, can you do any work extracted from us instead of the fee? So this is my one question, and second question is, what's the direct benefit of being an MS of this course for the future prospects within John Hopkins?
Do you want to take the first chunk of that, Morgan?
Yes, please.
Yep,
Yeah, thank you. That is
absolutely. Yeah, so even though you would be an online or international student, you would have the option to apply because there's sometimes like TA work studies positions that you can do online. That being said, that's more of it's unsecured, right? So you have to be admitted into the program. Some of these positions you have to have like certain GPA, be in the school for a certain amount of time. So you have the option to do those as they're available, but there's no like direct work to pay for your tuition kind of set up right now for the program. So yeah, I definitely understand that 45,000 is a huge investment to pursue education. So I would say, that's where I say some students kind of spread it out over time. Albert mentioned, and we would not highlight that some students on a 5 year plan, like tuition is a big thing. Um, Outside of the automatic scholarship, some students do external scholarships. So I would always suggest starting looking there, starting with the list that I sent. Um, and just kind of get the hunt from there. You can always, when you're ready, apply for the program. And we can give you a little bit more time if needed to kind of sort the funding out as well, because we want to set you up for success. We don't want to put you in a position either where, you start the program and you can't finish it due to funding issues, but we want to definitely give you time to kind of sort that out. And I do know because of the application deadline is quickly approaching, June 1st will be here before we know it. Students want to get their applications in. And I want to, give you time to do that, but also give you time to kind of sort out funding as well.
yeah, thank you.
And so Sarah asked a question, do you have a faculty mentor? Every student who enters the program has a faculty mentor assigned, sort of basically at admission. In addition, if you are interested in a particular topic, there are a lot of faculty in patient safety, and even more faculty, sort of in the School of Medicine, in the School of Public Health, and the School of Nursing that you could approach. People will frequently find someone who they're interested in. People will always meet with you, and it's even possible that you could find some work to do together with them. So for a research project or an evaluation or something that you are mutually interested in. So that's another opportunity in addition, Sarah.
Another question about the scholarship. Yes, just want to confirm again, the scholarship is automatically applied. So everyone that is admitted and accepted into the MAS program and starts the program, the scholarship will automatically be applied to your tuition. So you don't have to worry about doing an additional application for that. Someone asked just to clarify on the cost. So with the scholarship, the tuition is $898 per credit. It is 48.5 credits in the program. So the total cost of the program is roughly, because tuition changes yearly, just a little bit, $43,553. Okay, let's see.
We are kind of at the top of the hour. I see a request from Mike to send information about scholarship and finances and so forth.
Yes.
Thank you. People are dropping, I think, for other things. So I think we're going to wind up, but thank you so much for spending the hour with us. It would be great if any or all of you were to join us in the fall. We're very proud of this program. I think it is, among the best, if not the best, that of these online programs that exist. And so we're happy to share that with as many of you as possible. I hope you have a great day. It's really nice to meet.
Thank you very much.
And talk. Take care.
Thanks a lot.
Thank you, guys.
Thank you all.
Everyone.
Bye now.
Have a nice day.